Hello, my name is Dr Ipshita Mukherjee. I'm a consultant perinatal psychiatrist working in one of the perinatal community mental health teams here in GMMH. We work with women with moderate to severe mental illness and pregnancy up until 1 year postnatal, and we also offer preconception counselling. Part of my role is to talk about psychotropic medications in pregnancy and breastfeeding and help women and their families make an informed choice that is right for them. The pandemic has made the last year incredibly challenging. More recently, there's been a lot of talk about how the COVID-19 vaccination program will allow us to return to our normal lives. We know that you might have some questions about whether taking up the vaccine is right for you. There has been updated information released last month from both the Association of Reproductive and Clinical Scientists and the British Fertility Society. I'll summarise some of the key messages. Firstly, we know that the COVID-19 vaccines are highly effective at reducing the risk of becoming infected with COVID-19 and developing significant complications. There have been large clinical trials which have shown that the vaccines are safe and effective. The vaccines do not contain live virus, which means that there's not a risk of developing COVID-19 from having the vaccines. There is evidence that becoming infected with COVID-19 during pregnancy can increase the risk of babies being born prematurely, which can affect their long-term health. Getting vaccinated before pregnancy will help prevent COVID-19 infection and serious complications during pregnancy and beyond. There is no evidence that getting the vaccine impairs fertility in men or women. You do not need to delay getting the COVID-19 vaccine if you are currently trying for a baby or considering this in the future. Our fantastic vaccination team based at the Curve are here to help you. And if you have any questions or concerns, please do not hesitate to talk to them. The COVID-19 vaccines have not been tested specifically in pregnant women, so are not being routinely offered during pregnancy. However, if you are pregnant and at high risk of exposure to the virus, for example, due to your work, or at high risk of complications due to underlying medical conditions, then you may be offered the vaccine. Pregnant women and women who are breastfeeding and are already routinely and safely offered vaccines in pregnancy, for example, to protect against influenza or whooping cough. Many of these vaccines also protect their babies from infection. As time goes on and more data emerges, it is likely that the Joint Committee of Vaccination and Immunisation will recommend that more pregnant women are offered the COVID-19 vaccine. We advise you to speak to your GP, midwife or other healthcare professional to talk through the risks and benefits of vaccination related to your individual situation. If you go on the Royal College of Obstetricians and Gynecologists website, there is a lot of really helpful information to help you make an informed decision about the vaccine. Thank you so much for listening. Take care.